So then we go into ethical practice. In an ethical practice, as mentioned, healthcare providers face complex moral and ethical dilemmas. We see this every day here, especially when it's to elderly patients who, should be DNR or do not resuscitate, or should be full cope, but family wants to make them DNR, or whatever it may be. So those are ethical dilemmas. But the American Nurses Association, we have a code of ethics here that our primary goal, as I mentioned earlier, is do no harm while promoting good health outcomes. So you're not alone when it comes to ethical dilemmas, decisions, because every hospital has something called the bioethics committee. And the bioethics committee will assist with making decisions that gives the best outcome for the patient. So we do have to make sure that we advocate for the patient, which is our duty as a nurse, to minimize, here says minimize injury, but it's really to prevent injury. That is one of the Joint Commission, that's one of our surveying external sources, is to make sure we do zero harm. That's basically it. Minimizing injury is a great way to put it, but the ultimate goal is zero harm, preventing injury, protecting patient well-being. So when we have ethical practice, right? Autonomy, we respect for individuals' right of self-determination. So we can't coerce or force patients into doing the care that we want them to be because of our own beliefs. We have to respect their decisions, whether we believe that it's right or not. One of the biggest respects for individuals right here in the States right now is, the right to abortion, the right to, you know, uh, self-suicide, if they're terminally ill. So those are things that are very high on the end of ethical core concepts. But in a patient care area is, patient doesn't want to take their medication, we can't force them. Knowing that, even if we know that that medication is going to help their CHF or their COPD. So we really have to respect that. Beneficence is to do good, the duty to help promote well-being, which is within our scope. That's actually one of our core concepts in nursing. And then justice, fairness, the equitable distribution of potential benefits and tasks determining the order of which clients should be cared for, prioritizing the care for the patient, prioritizing your patients too of your workload. So prioritizing who needs to be seen first and get treated first. And then non-malfeasance, which is the do no harm. And we talk about the do no harm and patient safety a lot because that is a big focus here in the States. And then there's continuation of ethical practices, ethical decision-making in emergency situations, where patients cannot consent, their cultural personal beliefs, nurses' duty. We talk a lot about this as well in the slides for consents. You'll get a patient who has a very, very low hemoglobin, hematocrit, or H&H, and the only way to treat him was with a blood transfusion. But if their religious beliefs does not allow for blood transfusions, we have to respect that, but find alternatives. So there are alternatives that we need to be aware of to discuss to the patient to help them. And then, that's the culture and personal beliefs. And then the nurse's duty, again, respect the patient's autonomy when possible. Can't force care onto them. So conflicting ethical principles, the ethical dilemmas arise when two or more ethical principles conflict. And usually you see that with, the patient's beliefs, the nurse's belief, what's right, what's wrong. It's we as nurses know what's right as what we're taught to care for the patient, but the patient's belief might be their religious belief is that's against their religion, and we need to respect that. So as I mentioned earlier, we do have a ethics committee or bioethics committee where there's the group in the committee is the primary physician, the ethic committee medical director, the primary nurse, the charge nurse, the director of the unit, social services, and sometimes even case managers. And they talk about the case to protect. And the reason why there's so many people is because we want to make sure that nobody is biased regarding the case, to make sure that we're protecting the patient's rights, that we are acting on behalf of the best interest of the patient.